Today's topic is bacteria showing bipolar staining. What is bipolar staining? Bipolar staining in bacteria is also known as safety pin staining and occurs when bacterial cell exhibit dark stain poles at both ends of the rod-shaped bacteria with clear or unstained, lightly stained central region. This phenomena is primarily observed in gram-negative bacteria and particularly in the species of Yersinia and Pasteurella and stained with a special stain like Wesson stain or Giemsa stain. So Yersinia pestis is the first organism, gram-negative Coccobacillus. You know, there are three types of plague, that bubonic, pneumonic, and septicemic. So which is the rodents act as a reservoir, which is highly contagious, and the vector of transmission is Genopsella chuopis, especially in the bubonic plague. And this Yersinia pestis belongs to Enterobacteriaceae, and it also shows the safety pin appearance or bipolar staining. Then Pasteurella multocida, we have seen that the infection, one of the infection causing dog bite wound. This is a gram-negative Coccobacillus and zoonotic infection, soft tissue, or it may also cause respiratory infections. The species are Pasteurella multocida, Pasteurella septica, and Pasteurella gallicida. It is an encapsulated polysaccharide capsule is the virulence factor, and various serogroups we are given here A, B, D, E, F. Respiratory infections and skin and soft tissue infections, cellulitis, that is the clinical presentation. So this is the second organism showing bipolar staining. Then Francisella tularensis, which is causing tularemia, gram-negative Coccobacillus, zoonotic infection, and it is a category A bioterrorism agent, low infectious dose and high mortality. Therefore, the processing should be done in the biological safety cabinet. So infection comes from rabbit also, therefore it is also called as rabbit fever. So Francisella tularensis is the third organism which is showing bipolar staining. Then Burkholderia pseudomylae. Burkholderia pseudomylae, you can see it is a gram-negative, rod-shaped, and this is a growth of Burkholderia pseudomylae and chocolate agar showing wrinkled colonies. And this is a gram stain showing the bipolar staining of Burkholderia pseudomylae. So Burkholderia pseudomylae is the fourth organism showing bipolar staining. So this is the various aspects, the route of transmission. The disease is known as melioidosis. The disease may occur by inhalation, ingestion, or cutaneous exposure. Risk factors are diabetes, chronic kidney disease, liver or lung disease. Then next organism is Klebsiella granulomatis, or previously it was called as Calamantobacter granulomatis. The disease caused is zoonotinosis, which is a sexually transmitted disease caused by Klebsiella granulomatis, and there is a formation of ulcerogranulomatous lesions, most common presentation, or this hypertrophic, or it may be necrotic. Then fibrous, which resemble painless scar tissue, and formation of ulcers, which is slow growing, typically painless, bleeds easily, and the genital, groin, or anal area. Azithromycin is a drug of choice. So this is the organism showing bipolar staining. So this is the morphological structure of the cell, which is called as Donovan bodies. So Klebsiella granulomatis or Calamantobacter granulomatis, which is present intracellularly. You can see here bipolar staining resembling safety pin of appearance. So this is called as Donovan bodies. So this is the last slide now. This is a summary. So these are the organisms: Francisella tularensis showing bipolar staining, Klebsiella granulomatis, Burkholderia pseudomylae. Even in some books it has mentioned Vibrio parahemolyticus, which is halophilic Vibrio, sometimes show the bipolar staining. Yersinia pestis, Haemophilus ducrei also shows Pasteurella multocida. So PG students, please remember these names because it can be asked in the exam. VIVA, enlist the bacteria showing bipolar staining. Thank you.